I am the God that healeth thee. I am the Lord, your healer. And I sent my word, and I healed your disease. I am the Lord, your healer. This is his word. I am the God that healeth thee. I am the Lord, your healer. And I sent my word, and I healed your disease. I am the Lord, your healer. You sent your word, and you healed my disease. You are the Lord, my healer. Yes, you are.
Whether therefore ye eat or drink, or whatsoever ye do, do all to the glory of God. Good evening and welcome to another edition of Nature's Way here on Waves 96.3 FM. I am Debbie, your host, and I am delighted to be here with you sharing the information that is so vital to our health with you. God has been gracious unto us. He has spared our lives. He has given us health and strength, and we are eternally grateful to Him. You know, a lot of Sundays, um, almost every day of the week, in fact, there's a funeral service, and people are losing their lives because we are not living healthy. And I just want to encourage our listeners and our viewers to make sure that, the information that you hear on this program, you take it down and you look into it and try to change the way you eat and the way you live, because most of these diseases are lifestyle diseases, and our diet plays a very important role in our health. We are going to be continuing our discussions on the topic, the skeletal muscular system. And as I have advised you before, this is a very wide topic. So we are going to be on this for a while. And we have covered a lot of grounds already. And we are going to be continuing the discussion this afternoon. So without further ado, I'm going to just ask you to pause with me for a moment while I pray. Our Father which art in heaven, thank you for your grace and your mercies towards us. Thank you for all that you do on our behalf. Thank you, Lord, for the opportunity you have granted to us to be co-laborers with you. I pray that the information that will be disseminated this afternoon will be useful to someone, and that it will be shared so that others will know and hear and will practice these in their lives. Be with us, touch everything in studio so that they work to optimal. And I pray that at the end, your name will be glorified. Bless us now, we pray, and say thanks. In Jesus' name, amen. Yes, so we're going to be continuing our discussion. And as I have reminded you, the materials contained in this presentation is informative in nature and is not intended to serve as diagnosis, treatment, prevention, or cure for any specific health condition of our listeners or viewers. We at Nature's Way give no guarantee of nor assume any liability for the use of this information. We share the information here at Nature's Way because we care. The information is general information, so you can do your research as well. All right, we're not health practitioners. We just share the information that is researched and practiced by most of us. Some of these things we come across, and persons have been given these natural remedies, they have used them, and have positive reviews. So this is why we share the information with you. All right. So we're going to be looking at, last week we looked at bursitis, and we looked at ankylosing spondylitis as well. And we're going to be looking at a couple others on, and if we have time, we may just look at another one. But the one that we're going to be starting out with this afternoon rather, is temporomandibular. Temporomandibular, and this is a joint syndrome. The short for that is an acronym TMJ. So if you hear me mention TMJ, this is what I'm talking about, because this name is a bit long, and at times it can be, tongue twisting. So TMJ is what we're going to be looking at this afternoon. So the symptoms include pain in the muscles and joints of the jaws, and which can radiate to the face and to the neck. Now there is a frequent clenching of the jaws, possible headaches, toothaches, dizziness, pain, and ringing in the ears, and pressure behind the eyes as well. You can look out for these symptoms. Now, when eating or yawning, there is a clicking, grinding, and popping noise. Perhaps there is pain. There may be difficulty in opening and closing the jaws as well. Now, these are some of the symptoms, and if you experience any of these symptoms, you may just have temporomandibular joint syndrome. Now, the temporomandibular joint connects the jaw, the lower jaw, to our skull. The bite is misaligned either as a cause of the jaw problem or as an effect. The cartilage disc that cushions the joint becomes damaged. Now, this causes the bones of the temporomandibular joint to rub against one another instead of gliding smoothly past each other. Now, if the tooth repair or replacements have not been done properly, if you just recently went to the dentist and the tooth repair or replacements have not done properly, now this can be a factor in causing the problem as well. All right. So just to let you know, the temporomandibular joint, now these are two joints that connect your lower jaw to your skull. More specifically, they are joints that slide and rotate in front of each other, of each ear rather, and consist of the mandible, which is the lower jaw, and the temporal bone, the side and base of the skull. All right, so this is why this joint syndrome gets this name, temporomandibular, because it has to do specifically with the skull and the lower ear, the lower jaw, and those two bones right at your ears there. All right. And sometimes you hear people say they have lockjaw and all of that. Now, this is one of the symptoms as well. Now, this is the condition that they are experiencing. Now, stress, poor bite, and bruxism are the most frequent causes. Some people develop the habit of clenching their teeth together during the day or even at night, and this is called bruxism. This is very hard on the joint in the jaw. All right. An injury, poor dental work, osteoarthritis, bad posture, repeated or hard blows to the jaw or chin, whiplash, gum chewing, thumb sucking, chewing on only one side of the mouth, or holding the phone between the shoulder and jaw can cause it as well. All right. Rheumatoid arthritis can also cause jaw pain. So these are some of the things that cause you to suffer from this disease, temporomandibular joint syndrome. Most of our research, most of the research that we do, and most of the findings, they come out of the United States of America. So if you hear me mention Americans, it's because of the studies that come out of America. So about 10 million Americans have this problem. Yet it is estimated that 90% of all cases respond well to simple, inexpensive treatments. So, one of the treatment include put your little fingers in your ears, and this you are going to use to block outside noise. And then you slowly open and shut your jaw. Now, if you hear any clicking or grinding sounds, your jaw may be out of alignment. If not, you are good to go. All right. And one of my good friends is in studio. I have to share. Is trying this out. So, listeners, viewers, try this out and see what you hear. You can send your feedback. So, put your little fingers in your ears and you use this to block out the sound. All right. And slowly open and shut your jaw. Now, if you hear any clinking or any grinding sound, it means that your jaw may be slightly out of alignment. If you don't hear any clicking, or grinding sounds, you are good to go. All right. So, some of the remedies, and my friend is good to go. Very good. Uh, all right. So, we're going to be looking at some of the natural remedies that can use to treat with temporomandibular joint syndrome, or TMJ for short. Now, it is important to have a diet that is rich in B complex vitamins, calcium and magnesium, silicon, zinc, lecithin, and flaxseed oil. All right. So these are some of the things that you can use. All right. What you can also do is that you can fast once per month. And when you do this, you give the body and the jaws a rest so rebuilding can take place. Avoid sugar foods, which deplete calcium and other minerals in your bodies. And just to remind you that the bones are not just made up of calcium, there are actually 12 minerals that the bones are made up of. And I'm just going to remind you of them. Calcium is one, chromium, boron, iron, magnesium, manganese, silica, sulfur, potassium, phosphorus, zinc, and selenium. Now, also, your bones are also made up of 64 trace minerals, and all of these can be found in Celtic salt and or dark leafy green vegetables. All right. So we are to avoid the sugars because they deplete the calcium and all those other minerals that I have mentioned just now. Avoid smoking and do not eat meat. And every week, I remind my listeners, do not eat meat. This is harmful to our bodies. Do not drink caffeine beverages, including chocolate. And this is because the caffeine increases muscle tension and sensitivity to pain. Also, sugar and chocolate, they do this too. Avoid salt, salty foods, and sodium containing foods. Do not use alcohol. You may need to eat softer, easy chewing foods for a while. Avoid hard foods for a while. Do not bite your fingernails as well, because these are hard and then you are going to put a strain on that bone in your jaw. and then you are going to run into problems. You are going to start feeling some very excruciating pain. So you can also make sure that you have um, B complex, and you take this at least twice a day. At bedtime, you can also take the last one at bedtime. Now, what you can also do is at bedtime, in order to help relieve anxiety and improve sleep, you take vitamin C before you go to bed. All right. And you can also drink skullcap tea. Now, this is soothing as well. Boswellia and ginger herb. These are teas that you can put together. These herbs you can mix together to make a tea, and you can have these have anti-inflammatory effects. So you can have these hops, catnip, skullcap, or valerian root will also help to calm you down. Turmeric will help reduce pain and inflammation. You can add a teaspoon of turmeric to these any two of these herbs. So if say for example you're having boswellia and ginger herb, you can add some turmeric to that. If you're having hops and catnip, you can also add some um, turmeric to that. All right. Other helps include hot and cold packs, either together or separately. Now, this will help to relieve pain in the neck and in the shoulders. A washcloth soaked in almost hot water makes a good compress as well. So you're going to place it against the aching joint. All right. So learn to relax and avoid stressful thinking or situations. Remember, we told you that stress causes sickness as well. Herb teas of hop, skullcap, or valerian root will help to relax you as well. If you sit a lot, relax and maintain good posture. Do not hunch over and strain your back. All right. The idea is for you to keep calm and also be stress free. So, another thing that you're not to do if you are suffering from um, temporomandibular joint pain, syndrome, do not sleep on your side or lie on your side with your head turned to the side. All right. It is crucial that you sleep on your back when if you are suffering from this condition. Place a bean bag on each side of your head just to keep it in place, so you will stay on your back all night. So if you do that, when use the bean bag, if you are about to turn in your sleep, there will be something there that will deter you from turning. So once you are suffering from this condition, these are some of the things that you need to do or not to do. Do not prop your head up at an angle, especially when you are in bed. When you are reading or talking or watching the television, do not lean your head on your hands at any time. Do not chew after eating. So after you have finished eating your meal, don't chew after that. So this means um, other bits of food when the meal is over, or even chewing on gum. Because if you have this condition, you are going to suffer from that pain right there. And that pain is not a easy pain. All right. So there are some exercises that you can also do. This will greatly relieve jaw and head pain. So you're going to put ice on the tense neck muscle and stretch it. All right. So you are going to stretch that muscle, because that muscle now is tense. And remember, when you get the pain, it's because the muscle has tension or it is inflamed. Okay. So What you're going to do first is place a washcloth partly around an ice cube. So you're going to put the ice in the washcloth, and then 3 to 4 times rub the ice directly down the side of your head and neck over the muscle. Then stretch that side of your neck by bending your head, sorry, toward the other shoulder. So you're going to do one side of the neck, rub it on it, and then you do the other side. So you just bend it toward the other side each time. Hold hold it there for 10 seconds, then put your hand on the muscle to warm it up. So when you put the ice on it, after 10 seconds, after that, you're going to just put your hand on the area for about 10 seconds, and this will warm it up. So your hand now becomes warmer, so it will warm the area. And then work the muscle with your hand. So you're going to give it a little massage. Then repeat the procedure on the neck muscle on the other side. So the same thing you do on one side, you do the same thing on the other side. The cold blocks, the cold, it blocks the pain, so you stretch the painful muscle more than you otherwise could. So the coldness now will help you to stretch that muscle. Sometimes you have that tension in the neck and you are not able to move it. When you put the cold ice on it, the cold pack on it, it will help you to move it, and then you massage the area with your hand gently, because remember now you're kind of working the muscle. All right, and you do this over time until it feels better. This exercise will help reveal neck pain. Now you are going to place your fingers on the muscle near where it ends on the back of the neck behind the ear. Place your thumb on the point above your collarbone, close to your Adam's apple, where that muscle ends. Then gently pull the two ends of the muscles together. This is a reverse stretch. So you're going to do this reverse stretch that will help to relieve your neck pain. And you do this whenever your neck is painful. When you feel the pain in your neck, you do this exercise. Under normal circumstances, even if you are not suffering from temporomandibular joint pain, because sometimes you have your neck, you just hold it in a particular position for too long. For example, when you are using your cell phone and you tend to hold it between your neck and your shoulder, now that you can feel a little discomfort there. So you can also use this exercise to relieve that pain. Now, there's another exercise that will help to reduce pain in the facial muscles on the side of your jaw. What you're going to do, you're going to wash your hands and hook the index finger to the right hand inside the corner of the right side of your mouth. Yes, so your hands must be clean to do that. Do the same on the left side, both fingers down to the middle knuckles should be in your mouth. Next, gently push out your cheeks, and then you're going to stop before you feel any pain. Release and do this stretch 3 to 4 times, several times a day until there is relief. All right? So remember, your hands must be clean because you're going to be putting it in your fingers in your mouth. Now, there's another exercise that will help to relieve pain and pressure that is deep behind the eyes. The source of the pain is a spasm in the muscle that opens the jaw and moves it from side to side. If the pain is behind the right eye, put the end of your right index finger behind the upper right molar of your upper jaw so that the finger is pointed to the center of the skull and behind the eye. Press up to 5 times each time, holding for 2 to 3 seconds. Whether left, right, or both eyes, now this is the treatment to reduce the pain. And to balance your jaw muscles, you are going to gently try to open your jaws with your hands while resisting with your jaws. So you're working the jaw muscle. Then gently try pushing the jaw sideways while resisting your with your jaw. So whatever you're pushing on it, but then you're going to be resisting. Like you're trying to move it and you're not trying to move it. Because what you're doing now, you're pushing against the muscle. So you're strengthening the muscle. And in doing this, you're going to repeat this on the other side and do each exercise for 30 seconds, 3 to 4 times a day. And this will help to work the jaw muscles. Another helpful exercise is when you feel a yawn coming, resist it with your hands under your jaw. So you're going to kind of push it up. All right. At any rate, do not open your mouth too wide when you yawn. You know, some persons do that and they have what you call lockjaw. It's locked in place, and then you have to do that exercise. So once you find that you are suffering from these things, this is the condition that you have: temporomandibular joint syndrome. And these are things that can help you to relieve this. And we have looked at diet, and we have looked at nutrition, and we are looking at the exercises. So there, one of the symptoms is grinding your teeth. So how to stop grinding your teeth? First, think that your jaw is relaxed. So you're going to use your mind now. Think that your jaw is relaxed, and this will do it. Do this whenever you begin tensing or clenching your teeth. Second, never chew any substance when you are not eating. This includes no more chewing of gum. Keep your teeth apart, lips together, tongue on the roof of your mouth. All right? And then what you do, you use this. It's like you're using your mind power now to fight this. All right? So when your jaw feels tense, in your mind, think that it is relaxed. All right? And if you feel like grinding your teeth, just remind yourself, I am relaxed. So try this mind exercise. The mind is a powerful thing, listeners, viewers. So you can do this. All right? Now, we know that we cannot do anything of our own. We can do all things through Christ who strengthens us. So come daily to Jesus. He loves you. Open your heart to Him freely. In Him, there is no disappointment at all. You will never find a better counselor, a better guide, and a better defense, according to Psalm 32 and verse 11. So, in everything that we do, we must remember that we cannot do it in our own strength, but Jesus is there to help us. Come to Him daily. Put our desires to Him or troubles to Him, and He will help us. So all these exercises, all these things that you are not to do in order to treat with this syndrome, and everything that you are going through, just remember that He is there. He is our guide, our counselor, and our defense. So let us lean on Him, because when we call on Him, He will answer. All right? So that is it for temporomandibular syndrome, joint syndrome, or TMJ. And I trust that you have learned something from this. If you need to um, know the exercises, you can go back and listen to the 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 YouTube because we are on YouTube. All right. All right. So we're going to be looking at another one now. And this one is ganglion. This is ganglion and this is ganglion cyst. All right. So we're going to be looking at some of the symptoms of ganglion cyst. A hard lump which develops on the wrist or back of the hand, but sometimes on the foot as well. It varies in size from a small pea to a plum. So it depends on the severity, the size. Okay? It is now 5:30 p.m. You are tuned into Nature's Way here on Waves 96.3 FM. If you are just joining us, welcome. We are looking at the skeletal muscular system, and now we are looking at ganglion cyst. Now, what causes ganglion cyst? Now, a cyst is an abnormal sac in the body which contains fluid. A ganglion is a cyst that develops under the skin near a joint. It is filled with a jelly-like fluid. So sometimes you can touch it and it moves, but you will feel like something is moving in it because it is jelly-like. The fluid that is in the sac is jelly-like. The ganglion is usually an outgrowth from the capsule surrounding a joint or from the sheath of a tendon. Tendons are the fibrous cords which attach the muscles to bone. The fluid inside the ganglion cyst is derived from the synovial fluid which lubricates both tendons and joints. Now, ganglia are quite common and are generally painless. So you can touch them and they don't hurt you. As mentioned before, they have been felt as a lump under the skin and may be present for several years without causing any problem at all. But some ganglia become very uncomfortable or even may cause pain in the long run because it means that something else is going on. It's getting severe. So, we're going to be looking at some natural remedies to treat with ganglion cysts. A ganglion may disappear spontaneously. It can be removed surgically under local anesthesia. Sometimes these cysts they reoccur. A very nutritious diet of fresh fruits, vegetables, whole grains, legumes and nuts plus a wide spectrum of vitamin mineral supplementation will help reduce its size. Do not, do not, and I'm saying this again, do not overeat, even if the food is good. Even if you are consuming good food, do not overeat. Constipation will make it more difficult to shrink the cysts. So, this is one of the things that we are to avoid. Make sure our diet is filled with a lot of fruits, legumes, whole grains, and nuts. No, and a lot of fiber as well. Maintaining outstanding health through proper rest, exercise, and outdoor walking strengthens the body and helps it resolve this problem. Do not overwork with your hands while not obtaining enough rest. Make sure you rest. The cyst is a fluid enlargement, so astringent herb compresses saturated with witch hazel or white oak bark tea may help shrink them. It is easier to eliminate them while they are still small. So once you see it coming up, try to, work on it. Now, in some instances, antibiotic herbs are recommended, and these have helped to reduce these cysts. So you can do that. Um, it is known that even bone spurs, which in some ways are similar to these cysts, and these can be removed as well by taking these compresses and using these antibiotic herbs. Now, the Lord has encouraged us that we are to ask in His name. Christ is the connecting link between God and man. He has promised His personal intercession. So, whatever it is we are going through, and whenever these things come upon us, let us go to Him. Let us ask Him. Ask Him to show us even the natural remedies. Some of us, as anything happened to us, we run to the physicians. But there are things that we can use to naturally heal our bodies. And we ought to, this is why Nature's Way is here to help you along a healthy, wholesome living. So, this is why we are sharing this information with you. So, ganglion cyst, no, these are the things. These remedies are quite simple: fresh fruits, vegetables, whole grains, legumes, and nuts. Plus, make sure you have your vitamins and minerals. Now, if you are not eating enough of these, you can take the natural supplements, and I'm stressing the natural supplements. All right, but we get most of these from the food that we eat, but we have to know the portion to eat. Even though we are cautioned not to overeat, even if the food is good, we are eating good food, and some persons will tell you that the food is good, so I have to eat a lot of it. But we are not to overeat, because that in itself causes another problem. And overeating can also lead to constipation. It can lead to diarrhea and or constipation. So when you are constipated, it is more difficult to shrink the cysts. So we don't want to do that. All right. Now, we know this term shin splints, and we're going to be looking at that. And some of the symptoms of shin splints is pain in the shins or of one or both legs. Sometimes it happens in one leg, sometimes it happens in both legs. Now, there may or may not be a specific area of tenderness. Pain and aching will be felt in the front of the lower leg after or during an activity. The experts are not clear what cause splint shin splints, but they may be an irritation of the tendon which attacks the muscle to the bone, or they may be a muscle irritation or the beginning of a stress fracture. Active people have shin splints. For example, 28% of long distance runners and 22% of aerobic dancers they develop shin splints after a period. They are caused by excessive walking, excessive running, or jumping on a hard surface. So some of those long jumpers, high jumpers, well, the high jumpers, they normally land on a soft surface, but these things that we do excessively with our legs can lead to shin splints. Other factors include poor shoes. So we may wear a shoe that is not fitting for our feet. Sometimes the shoe inside is hard, the soles are hard. Sometimes they are not exactly our size, and maybe they may be too high or even too low. So we have to strike that balance. Fallen arches, insufficient warm up, poor posture, insufficient warm up when you are going to, if you are going to participate in a sporting activity, poor posture, faulty walking and running techniques, overstraining, or pinched nerves. Now, these are some of the things that can cause shin splints. Sometimes the early stages of stress factors fractures are thought to be shin splints or vice versa. But there is a difference. Now, stress fractures begin with pinpoint pain about the size of a dime or a quarter, around or on a bony area. A shin splint is a generalized pain or aching discomfort up and down the whole shin. But if the problem is not stopped, shin splints can develop into stress fractures. So we have to ensure that once you have that suspicion, you treat with it. And some of the natural remedies include, so the athletic trainers call it RICE, rice. And rice is rest, ice, compression, and elevation. And the athletic trainers do these to this technique to athletes. So it is called rice, rest, ice, compression, and elevation. So you are going to do this for 20 to 30 minutes. Prop up the leg, wrap it with an ace bandage, and place the ice pack on it for 20 to 30 minutes. You can lift it at times, because sometimes it gets painful and cramped. An alternate method is a 1 minute contrast bath of ice followed by a 1 minute of heat. So you will do hot and cold. So you do this for at least 12 minutes. This is especially good for pain in the inner leg rather than the front where the shin splints occur. Now, the other technique is massage. You're going to massage the area near the shin splint pain, but not on it. You're going to just do the area near it, near to the pain, not directly. If you rub on it, the inflammation will worsen. So sit on the floor and lightly stroke on the sides several times. Then wrap your hands around the calf and with your fingertips stroke deeply around on each side of the shin from ankle to knee. Do the entire area, pressing as deeply as possible on the area. So the other thing you're going to do is to try to correct the flat feet or very high arches. So if you can, now they can also cause shin splints. So if you have, if you, some persons have high arches, or we call it high instep. So if you have a high instep and you're not able to wear very flat shoes, you wear a shoe with a little heel. All right. So, in order to prevent you from developing shin splints. Now, the nutritional supplement MSM is a form of sulfur that can help reduce muscle soreness and inflammation. This is recommended for you to take 1 gram on a daily basis. And this can help to reduce inflammation, as well as you can use the turmeric. So you can drink the turmeric tea, you can put it with those other herbs for pain like valerian root and so on. And you can use this to eliminate the inflammation as well. The podiatrist can give you shoe inserts which correct problems with with your orthotics. All right, so you can use that as well. Now, prevention. So try to avoid a lot of hard activity on unyielding surfaces such as concrete. Even carpet on concrete can cause the problem. So once the surface is hard, even if you put a carpet on it, it can still cause problems for you. So avoid hard activities on these hard surfaces. Grass or dirt is better than asphalt. Asphalt is also better than concrete. So wear good, comfortable shoes, and when they start wearing down, buy new ones. For some persons like myself who my feet are not very straight, and after a while I find that my because the shoes start getting lean or out of alignment, I find that get some pain in my feet. So then what I have to do, I have to change the shoes and get the new shoes that is already straight. And when it's the shoes start getting worn, I have to get rid of it because it's going to cause pain. And I don't want to end up having shin splints and spurs and all of that. All right. So make sure your shoes is comfortable and you just spend the money and buy a good pair of shoes that can last you for a while. Okay. Stretch your calves and Achilles tendons frequently. Now, this helps prevent shin splints. Shortened calf muscles throw more weight and stress forward to the shins. So, to stretch your calves, place your hands on a wall, extend one leg behind the other, and press the back heel slowly to the floor. And you do this about 20 times and repeat on the other leg. So you do that 20 times for each leg. To stretch your Achilles tendons, have both feet flat on the ground, about 6 inches apart. Bend your ankles and knees forward while keeping the back straight. When you achieve tightness, hold it for about 30 seconds and you are going to repeat this about 10 times. All right? And these are some of the exercises that you can do. And stretching is very good. Stretching is a very good exercise for this. You stretch your calves and you make sure that you do these exercises to help to alleviate the pain that you're feeling. And remember, excessive walking and running or jumping on hard surfaces can compound the problem. All right. And remember again that the shoes that you wear is also important. And if you are going to participate in any activities, sporting activities, make sure you stretch and you do your warm up, adequate warm up. If the warm up is insufficient, it is going to cause problems for you. So make sure you're going to have a pull muscle and then your calves are going to be painful and all of that. So do your stretches. Even if you are part of a group and the group has started already, make sure you do the stretches before you start the activity because it is going to cause further problems. And remember this acronym RICE. You are going to rest. You're going to do the ice pack, put the ice pack on the area, and then you're going to do compression and elevation. And you are going to do this for 20 to 30 minutes at interval. Remember now, you want to heal the situation. So you are going to do this. It is now, wow, 5:49. We are traveling here on Nature's Way. So I just have a few more minutes to share another one with you. I'm sure I may have to continue this one, but I just want to share that one with you. But just to encourage you that only by following Christ's example can we have genuine happiness. He alone can strengthen us for the trials of life. He alone can guide us through these trials. The Lord has not changed, and He never will. He is true, merciful, and faithful to fulfill His word. Determine that you will stand with Him in the battles of life. He is the best friend you will ever have, and He deserves your love and obedience, according to 2 Peter 1 and verse 11. The best friend to have is Jesus. In all our trials, in all our situations, irrespective of what it is, if we are going through troubles at work, everywhere, and if we are going through health problems, family problems, stresses, and all of that, we can go to Jesus because He is there to help us. Ask in His name all the help that we need. And He says He is the connecting link between God and man. So He has promised that He will take care of us. And if we stand for Him, He will stand for us. All right. So we're going to be looking at another situation here, and this one is tendonitis and tenosynovitis. So this is tendonitis and tenosynovitis. All right. Now, the symptoms are pain in the tendon, whereas simple muscle soreness soon go away. Tendon pain can continue for a long time. A tendon is used in the same repetitive motion while ignoring initial indications of tiredness. It occurs most frequently in the shoulders, in the hips, or um, Achilles tendons, and also in the ankles. Tendonitis is inflammation of a tendon, which is the fibrous cord that attaches a muscle to a bone. Um, Tenosynovitis is inflammation of the sheath of tissues that surrounds a tendon. Now, these two conditions usually occur together and are also treated together. Tendonitis around the shoulder, elbow, wrist, fingers, thigh, knee, or back of the heel are most commonly affected. Now, these are the areas that are most commonly affected. And we know that these are all from overuse. All right. So, some of the natural remedies include, and they are not limited to. Now, when this occurs, you have to stop the particular activity. And you have to stop this for a while until you are better. So, even if the activity is your primary employment or sport, even if it is your breadwinner, you still have to stop. All right? Whether it be window washing, long distance swimming, pitching, or anything at all that allows you to overuse your muscles and get tendonitis, no, you have to stop just for a time. Do not rest for too long though, because your muscles will get seized up. All right? And while you are resting, you do not want to have absolute rest, because you have to use up your muscles in order for them to work well as well. So soak in a warm bath, or you can have a whirlpool bath. Warming the tendon before stressful activity decreases the soreness. So if you take a warm bath, this will help to warm the tendons. Apply a heating compress. Place a warm, damp towel over the area. For example, if it's in your knee or your ankle, you can use that, or even your wrist. Put a plastic over the area, the towel, so you have a warm towel, and then you're going to put a plastic over that. And if you have a heating pad, you put that on top, and then you put a loose elastic band or a bandage over that. Now you're going to keep it in place for 2 to 6 hours. So it would be good if you can do that overnight. With the pad, you have to set it on low to prevent burning. So during this time, try to keep the injured part higher than your heart. So you're going to elevate, if it's in your leg, you're going to elevate your leg. Make sure it's higher than your heart. An alternate method is to wrap the painful area in an ace bandage, but do not wrap it too tightly or keep it on for too long. Proper circulation must be maintained, because if it's too tight, you are going to stop the circulation. So you're going to raise the affected area to help control the swelling. Now, there are some things that you are not to do. So before a workout, carefully warm up. Make sure you warm up. This is important. You can take the tub bath to warm up, a warm bath. Now, this can precede the warming up exercise out in the field as well. Before the hard exercise, carefully stretch your muscles to limber them. Stretching helps prevent the shortening and accompanies the shortening with the accompanying exercises. So when you stretch, you prevent the muscles from shortening. And then when you do the accompanying exercises, they would already be stretched. So you won't have any muscle ache, or you feel as if you can't stretch your leg. Ice, this can be placed on the area after you have done your exercise to reduce swelling and pain. But those persons with diabetes, heart disease, or problems with blood vessels should be cautious about using the ice. The danger is that doing so can constrict blood vessels and loosen the clots. If possible, switch to a different exercise format for a while. All right? Now, runners can switch to cycling, etc. Strengthen your muscles, but do it gently. Whatever your activity, take breaks occasionally and walk around or do something different for a while. Now, this helps to relax your body and improves circulation. Breathe deeply. Deep breathing also helps, and you can enjoy it for that moment. All right? Now, our bodies is a temple of God, and we are to take care of it. Whether therefore we eat or drink or whatsoever we do, we make sure we do to the glory of God. Now, there is another temple. The temple of God is opened in heaven, and the threshold is flushed with his glory. He will help all who will surrender their lives to him. And my encouragement to you this evening is, everything that we do, we must glorify God and we must surrender our lives to him. His coming is imminent, it is even at the door. So let us remember that our only hope, our only help is in Christ Jesus. So let us surrender our all to him. Let his will become ours. Okay? I hope that the information that is shared is useful, and that we will purpose in our hearts to be his children, so that when he comes, he will save us. Let us pray. Our Father which art in heaven, thank you for the information that you have given. I pray that you will be with your people even now and help them, dear Lord, to look to you always, the author and finisher of their faith. Bless us now, we pray, as we say thanks in Jesus' name. Amen. It's goodbye from Nature's Way until next Sunday, same place on Waves 96.3 FM.
I am the God that